Whether you are playing a video game or catch in the backyard, you need to coordinate the movement of your wrist, hands, and fingers. Now, most muscles that move the hand and the fingers are located in the forearm, and they're innervated by the median nerve. The median nerve, along with forearm muscle tendons, travels through the wrist under the carpal ligament, also known as the flexor retinaculum, and it stabilizes the tendons of these muscles. We become painfully aware of this anatomical relationship with injuries such as carpal tunnel syndrome, in which inflammation of the tendons compresses on the median nerve. Now, this lesson will describe the muscles that move the hand, the fingers, and the thumb. We will organize our discussion based on common functions as we examine muscles that flex the hand at the wrist, muscles that extend the hand at the wrist, and muscles that move the fingers and the thumb. Let's start by examining the muscles that flex the hand at the wrist. These are long muscles that run along the anterior part of the forearm from the elbow to the hand. At the elbow, they originate from the medial side of the humerus. The distal tendons are held in place at the wrist by the flexor retinaculum, as discussed previously in the context of carpal tunnel syndrome. You can actually feel these tendons as you flex your fist. Now make a ball with your hand and you can actually see the tendons. The flexor carpi radialis is so named because it courses over the radius in the forearm and inserts on the wrist bones. Likewise, the flexor carpi ulnaris courses over the ulna in the forearm and inserts on the wrist bones as well. The palmaris longus runs in between the flexor carpi ulnaris and radialis, and it inserts on the flexor retinaculum, not the bones. Pitchers can have problems with these muscles as they forcibly flex the wrist just as they release the baseball. The muscles that extend the hand at the wrist are located on the posterior portion of the forearm. The tendons of these hand extensor muscles pass under the extensor retinaculum and attach to the hand, similar to the flexor retinaculum on the anterior side of the wrist. These muscles have names similar to the flexors as they course over the radius and the ulna in the forearm. Let's take a look at them. The extensor carpi radialis longus and the extensor carpi radialis brevis originate from the humerus, course over the radius, and insert on the hand. Now, as the name suggests, the longus is longer than the brevis, like brief. The extensor carpi ulnaris originates from the humerus and ulna, courses over the ulna, and inserts on the hand. While both of these muscles cause extension of the hand, the radialis muscle causes abduction, while the ulnaris causes adduction of the hand. Now, if you consider